So coming back to how the male partner also, and what the male partner also feels, they also feel a lot of the emotions that the women feel. It's just that they're toned down. And that's because of a couple of reasons. Number one is society expectation.
Society expectation. Then sometimes they feel that if I discuss my stressors with my wife, she might already be stressed out. It might worsen her situation. But reverse can also happen. If you discuss your issues, she may also discuss. Both of you can become a support for each other.
Yes, exactly.
Because if you are not talking, she's also not conveying. Both of you are suffering. So sometimes they feel this is what I have read from an article, that see, sometimes there is a male factor in fertility, and above that, if he expresses that he's feeling sad or anxious, he sometimes feel that he's basically portraying him like a less masculine, whereas stress has nothing to do with masculinity. So there are many social factors that are there.
Yes. I think the social factor is the one trigger that everybody goes through. So I kind of feel bad for the male partner, because he has to take care of his wife's needs and her emotions. At the same time, he has to stagger his emotions in such a way that the wife doesn't feel it. The wife is shielded. And in many families, I guess in-laws also come into the picture. Extended family comes into the picture.
Yeah. Yes.
This guy has to be
this guy has to be strong. And sometimes they may start protecting the boy. So that actually disturbs the whole dynamics. Best way in cases of psychosocial problems is talk. Talk to the concerned person. The more you speak, easier the pathway it will be for you. And one advice I want to give, quite often what happens, people start giving advice to others.
Yes, exactly.
Which is totally no.
Yeah.
They should ask. See, all of the people, most of the people, I'm not talking about people, those who are having mental retardation or those things. Everyone has normal IQ. Okay. Everyone knows how to cope, how not to cope, what to do. The problem is at that moment, they are not able to think in that way. Over that, if you are trying to put your advice, what will happen? They will feel overwhelmed and they will like form a emotional shield around them. They will not take it. Best way is ask them, promote them to talk more. And if you feel that they are not telling you their problem, just give them a reassurance that, okay, in future, if you want to talk to me, I am always there to listen to you. Don't feel hesitant. These kind of words, they will stay in that person's mind or heart, and he will surely get back to you. One should give them time.
Yes. To extended family. So for women, it's no secret that the woman feels a lot of emotions, especially from the extended family. And I'm sure male also feels. How do they cope differently?
See, coping wise, what happened? Coping, how do we learn coping? First thing is this. Coping we learn from our surroundings.
Yes.
Okay. So usually what will happen, usually I'm not saying all. Male will cope by externalizing their emotions in the form of anger. Okay. Or they will just go out of the place. They will not sit and they will not talk much. I'll share one case again with you today's case only, not related to infertility, but about how a male expresses his emotion and how a female expresses his emotion. Old couple, they came to me. Age must be around between 65 or 70. Okay. Children are staying at some other city. Now this lady is on treatment for anxiety disorder. She has been coming for last 3-4 months. It was her third or fourth visit. So she had opened up with me now. So she started saying that my husband, he doesn't talk to me much. He just goes out of the house. He doesn't spend time. And then she started saying that I know my children, they also don't love us.
Mm.
And they don't want us with them. I asked, how do you know?
Mm.
She said that this is like festival time is coming in northern part of India. She said that my daughter, she said, you come to my house, but don't bring my father.
Mm.
Okay. And she told it in front of her husband. And by saying that, her tears started coming out of her eyes.
Of course.
I just looked at the husband or the father. He was wearing specs, eyes completely wet, but tears were not coming out. Okay.
Yeah.
And she said that he's so strong, he doesn't feel anything. And then he spoke, but his voice started trembling. He
Mm.
said, I also feel.
Ah.
Only thing is, I can't say. And he just got up and he went out of the clinic.
Mm.
While he was going, I just said one thing, you can come back whenever you want. I will talk to you. He said, I'll come later. The thing was that he would have been a person who would have like been the head of the family, maybe a bit strict person, maybe, I'm not sure. Now when he's feeling weak, he doesn't want to express that he was weak in the past also. I told you this thing because just to tell you the coping mechanism.
Yeah.
She was sitting, she was crying, he got up and he went because he didn't want that anyone can see his tears.
Yeah.
So such things, they do happen. What family members should do is, they should, in case of infertility, let's come back to the topic of infertility. They should understand that boy also feels the same. Only thing is, female in our society, female are like looked upon like social duty or responsibility of bearing a child.
Yeah.
So all the focus goes on her.
Yeah.
Focus doesn't goes on father, but the thing is, father also wants a child in his house. So he also feels sad. So let's talk to him. Let's try to help him speak out his emotions. And he should also feel, he should also try to express itself
Yes.
himself.
Yes.
It will become easier for husband and wife to go through this journey.
Do you have any parting advice to anyone watching this?
See, advice is, if you are feeling,
Mm.
for the males at least,
Yes.
if you are feeling that you are having some physical symptoms, a headache, body ache, these things, sleep disturbance, or you are feeling that you are not able to focus attention on your work, you should go and take a psychological help. Number one. For the female partners, those who are watching this video, if you feel that behavior of the male partner is not same as it used to be in the past, I understand that you are also suffering from, you are also going through emotional turmoil. Just try to ask him that you can express you can share your feelings. We can discuss it. In that case, he may share it with you, and it will help you. It will help both of you to develop a stronger bond, because both of you are in a boat which is not going very smooth. So it may help you to become better partner.
It definitely will.
Thank you.
Sabaka Health Tech wishes you the very best in everything you do.
Okay, thank you.
All right. Bye-bye.